Hi, this is Vic. Remember, the CyberKnife kills prostate cancer. It cured me of my prostate cancer in 2007. It is now 2015. And it did it without surgery. I went through treatment for 4 days in a row, driving on my way to work, and there was absolutely zero interruption between my activities with my wife. Absolutely no interruption in my daily or evening activities at all. And it was pain-free, and I felt great.
Welcome to the CyberKnife patient education video. During the next few minutes, we hope to help you better understand how the CyberKnife robotic radiosurgery system is used to treat prostate cancer. We believe that the more a patient and their family and friends know about the steps involved in the CyberKnife treatment, the more comfortable everyone will be with the procedure. The CyberKnife system is one of the most advanced stereotactic radiosurgery systems in use today. It relies on robotics and sophisticated image guidance technologies to attack tumors with extreme precision. The flexibility of the robotic arm enables your doctor to deliver multiple beams of high-dose radiation directly to your tumor from almost any angle, while minimizing damage to surrounding healthy tissue and critical structures. The challenge that doctors face with treating tumors in the prostate is that the prostate moves unpredictably as air passes through the rectum and as the bladder empties and fills. Conventional radiation therapy does not account for this movement, but the CyberKnife robotic radiosurgery system does. The CyberKnife system is able to overcome this challenge by continually identifying the exact location of your prostate throughout the course of the treatment. It allows you to lie and breathe normally during treatment and enables your doctor to zero in on a moving target, your prostate, and treat it without harming surrounding critical structures or healthy tissue. As a result, your treatment is more comfortable, radiation is delivered more accurately, and treatments can be completed in a shorter period of time. Your treatment involves a team approach in which several specialists participate. Once the team is in place, you will begin preparation for the CyberKnife treatment. As part of your diagnosis, your doctors will have measured your PSA, or prostate-specific antigen levels, via a blood test, which will be used to help track your treatment results. Prior to CyberKnife treatment, you will be scheduled for a short outpatient procedure in which 3 to 5 tiny gold seeds, called fiducial markers, are inserted into the prostate. For prostate treatments, the fiducials are placed through a needle, which is guided via an ultrasound. You may be asked to clean out your rectum with an enema the day of the fiducial placement. The CyberKnife system uses the fiducials as reference points to identify the exact location of the prostate. After insertion of the fiducials, you must wait approximately 1 week before CyberKnife treatment planning can begin to ensure the fiducial movement has stabilized. During setup, a special custom-fit body cradle will be made. The cradle is made of a soft material that molds to your body and is created to make your treatment more comfortable and to ensure your body position is the same for each treatment session. While lying in the cradle, you will undergo a CT scan. This CT data will be used by the CyberKnife team to determine the exact size, shape, and location of your prostate. An MRI scan also may be necessary to fully visualize the prostate and nearby anatomy. Once the imaging is done, your body cradle will be stored for use during your CyberKnife treatment. During treatment planning, your relevant CT, MRI, or PET scan data will be downloaded into the CyberKnife system's treatment planning software. Your medical team will determine the size of the area being targeted by radiation, the radiation dose, and will identify critical structures, such as your bladder and rectum, where radiation should be minimized. After your treatment plan is developed, you will return to the CyberKnife Center for treatment. Typically, treatments are completed within 5 days. For most patients, the CyberKnife treatment is a completely pain-free experience. You can dress comfortably in street clothes, and your center may allow you to bring music to listen to during the treatment. When it's time for your treatment, you will lie on the custom body cradle made during the setup process. When you are ready for treatment to begin, the location of your prostate will be tracked and detected continually as you breathe normally. Your medical team will be watching you every step of the way as the CyberKnife watches your prostate, follows it as it moves, and safely delivers radiation to the prostate. The CyberKnife system's computer-controlled robot will slowly move around your body to various locations from which it will deliver radiation to your prostate. At each position, the robot will stop. Then, special software will determine precisely where the radiation should be delivered. You can expect each treatment session to last 30 to 90 minutes, depending on your specific tumor. Nothing will be required of you during the treatment, except to relax and lie as still as possible. After completing your CyberKnife radiosurgery treatment, it is important to schedule and attend any follow-up appointments. You must keep in mind that your tumor will not suddenly disappear. Once treatment is complete, most patients quickly return to their daily routines with little interruption to their normal activities. If your treatment is being delivered in stages, you will need to return for additional treatments over the next several days as determined by your doctors. There are generally only minimal side effects from CyberKnife treatments. Occasionally, patients report temporary symptoms, which may include reduced urinary stream, burning with urination, having to urinate more frequently, increase in frequency of stools, loose stools, and more gas with bowel movements than usual. Your doctor will discuss all possible side effects you may experience prior to your treatment. Additionally, your doctor may prescribe medication designed to control any side effects should they occur. Response to treatment varies from patient to patient. Clinical experience thus far has shown most patients respond very well to CyberKnife treatments. Your doctors will monitor the outcome in the months and years following your treatment.
Hi, I'm going to start off this presentation with a rhetorical question. If you were to drive your car approximately 50 miles, how much gasoline would you use for 50 miles or 47 miles? Okay, well, looking at the screen, you can see I drove 47.4 total miles, and I used 1/4 of a gallon of gas. 1/4 of a gallon of gas. And at that, and using gasoline at that rate is equivalent to getting 179 miles per gallon. Now, the way the ELR calculates MPG is based on the total number of miles traveled and the amount of gasoline used. Now, I traveled 47.4 total miles, and I used a total of 0.26 gallons of gas, approximately 1/4 of a gallon of gas. That's about 1 quart. Okay. Now you see the circle is part of this. Most of the circle is green in color. That is the portion of the mileage that was used, that was driven on electricity that was only in the power supply from the car being charged. And the blue portion represents the electricity that was being used from the generator or the gas engine when I started it. That was done for 9.8 miles. So based on traveling, well, the ELR calculates mileage based on total number of miles traveled and how much gasoline you used. Okay, now based on that, based on the total number of miles traveled and the total number of gallons used, that's about about a quart of gas, 47.4 miles. At that rate, the computer calculates 179 miles per gallon. That's why it's incumbent upon the owner of an extended range electric vehicle to start off with a full charge, so that you use as little gas as possible, and you emit as little poisonous fumes as possible as well. The vast majority of this last trip was off of electricity stored in the power supply, and a small portion of it was from electricity generated by the engine or the generator. Now, the way the ELR works is once it's charged, once there's power in the power supply, then I can drive the car for however many miles I have left until I start, or until if the computer starts the generator or the gas engine automatically, then that's as far as I can go. Or I can go until I decide to start the generator or the gas engine. Typically, I start it before the computer will automatically start it, because I want to go in a preferred mode, that is mountain mode. Mountain mode allows the car to allows the generator or the gas engine to do two things at the same time. That is, provide propulsion power while at the same time provide power to increase the charge to the power supply. So that if I'm driving long distance, for example, just a hypothetical situation, if I'm driving long distance and my power supply is reading, let's say I'm reading 6 miles left on electric range, then I can start the generator or the gas engine and let it run for 3, 4, or all of those 6 miles, or however long I want it to run for, until the charge gets up high enough to where I feel like I want to shut it down. And while that's charging, I can still continue to drive, and I think that's absolutely wonderful. Now, the speed of the generator or the speed of the gasoline engine in the ELR is not dependent upon the speed of the car. The generator or the engine is an electric generator. Generators want to run at one specific speed. The speed, whatever the engineers designed it to run at for that specific system. In the ELR's case, it's about 1800 RPM. Is what I was told by the technician. The speed of the generator is always running at 1800 RPM, independent of the speed of the car, if the engine should be running. Most of the times my engine is not running. And 179, this is a new record for me, a new personal best. 179 miles per gallon on one particular trip. For 47.4 total miles, I've consumed gas at a rate of where I can get 179 miles out of 1 gallon. This is absolutely fantastic. It's a new personal best. I anticipate that very soon I'm going to go over 200 on a particular incident. And that's going to cause my lifetime average to greatly increase too. You can see it's 81.9. When I first started this particular series of videos, my lifetime average, I think, was 80.9. And in approximately 2 weeks, it has increased to 81.9. It is now August 21st, 2015, and I'm at 81.9 lifetime miles per gallon on the car.